Cancer has been a hot topic all over the United States. There are many different types of cancers, like, for example, bladder, brain, breast, cervical, ovarian, and prostate cancer, and numerous amounts of others. Cancer is the most common cause of death, accounting for 1 out of every 4 deaths in the United States alone. This year, there's an estimated 1,665,540 new cases, and out of those, 585,720 are estimated to be terminal. Today I will be talking to you about the most common cancers among women and the most uh, common among men. Um, I will be informing you about the risk factors, early detection, incidence, mortality, and survival and screening. I will first be talking to you about breast cancer, the most common in women. Although there are a number of cases with men having breast cancer, it is still the number one cancer found in women. There are different kinds of breast cancer. An in situ diagnosis is an in situ diagnosis in, indicates that the abnormal cells have not spread from where they developed. More than 80% of in situ diagnoses are ductal carcinoma in situ, or DCIS, and about 12% of in situ cases are lobular carcinoma in situ, LCIS. Not, it's not an actual cancer, but uh, women with LCIS are 7 to 10 times more likely to get breast cancer are 7 to 10 times more likely to get breast cancer. Ductal carcinoma in situ is, or DCIS, can also become invasive case if left untreated. Invasive breast cancers are cancers that have broken through the ductal or glandular wall from where they originated and grown into the surrounding breast tissue. There are 4 main invasive subtypes, which are luminal A, luminal B, basal-like, and HER2, that have been identified using gene expression profiles. They can also often be identified by the presence or absence of estrogen receptors, ER, progesterone receptors, PR, and human epidermal growth receptors, 2, HER2. Overall, luminal A is the most common invasive breast cancer found. There are many factors that can cause a completely healthy woman to get breast cancer, and one of those is age. The probability of a woman developing breast cancer as a completely healthy woman at the age of 20 is about 0.06%, or 1 in 1,732 women. And as you increase in age, that number only grows. By the time you are about 70 years or above, you are about 3.84% more likely, or 1 out of every 26 women, to get breast cancer. But your overall lifetime risk is about 12.29%, or 1 out of every 8 women throughout your lifetime. In different racial and ethnic groups, white women have a higher incident rate than any other. But African American women have a higher mortality rate than any other. But overall, Asian and Pacific women have the lowest in incidence and mortality. There are many breast cancer risk factors. Some factors can be, once again, age, family history, genetic predisposition, breast density. Some lifetime-related causes can also be obesity, physical inactivity, and many others. And lastly, I will be talking about the most common cancer among men. Prostate cancer is the most common after skin cancer. Prostate cancer has many factors that are like breast cancer, which could be age, family history, and also smoking, obesity, and physical inactivity, referred to as adenocarcinoma or glandular carcinoma arises in the peripheral zone from semen secreting prostate gland cells that become cancerous. The cancerous cells are initially localized, but then multiply and invade into the surroundings, forming a tumor. And the tumor continues to grow into the surrounding areas and even bones. The tumor from prostate cancer can be frequent and painful urination, mostly at night, can also cause blood-stained urine and can cause renal failure. Prostate cancer can cause pain. The tumor from prostate cancer can be frequent and painful urination, mostly at night, can also cause blood-stained urine and can cause renal failure. Prostate cancer can cause pain in the abdomen, back, pelvic area, and other bony areas. Can also cause numbness and weakness in the lower half of the body. The test that can be taken for breast cancer is mammograms. You can take a mammogram every 6 months or when you think it is needed. Prostate cancer, you can get a prostate exam and prevent any kind of cancer. Thanks for listening to my speech. God damn, why not everybody